Hi, this is John Bray Morris, and welcome back to the Shooting Up in the Dark video series. Why do people use and abuse drugs? It may seem like a simple question, but it actually is a complicated one. If we knew the answer why people used and abused drugs, perhaps we could stop them from using, or perhaps there wouldn't be so much addiction in society. Well, I'm going to propose to you that there is a fairly consistent and relatively simple reason why some people use and then end up abusing and becoming addicted to drugs. And that reason is because the drug works for them, because the drug is a solution to a problem. And most often, that problem is some type of deeply rooted personal pain. If you were to ask me, why did I use my prescription medication and then continue to use and abuse it for reasons other than my physical pain? I would have to say that because for me, and this isn't the case for all people, it's the case for a minority of individuals, but for me, the opioid medication worked on a level inside my brain where it alleviated a lot of pain that I was feeling that had nothing to do with physical. I was under a lot of emotional and mental duress that had its roots probably in pre existing trauma, childhood trauma, all kinds of stress, relationship stress, pain associated with my personality type, probably with work related stress, relationship associated stress, even deep things like existential associated pain that all humans have was part of it. And the opioid relieved that pain that I was carrying with me at that particular point in my life. And it did so in a very profound way that for me felt liberating, felt freeing, felt like it made me a better version of myself. So, my perception, and I think the perception for many, many people who initially become hooked on a drug or a drink or whatever their drug of choice is that the drug is a solution for them. It frees them from something that's holding them back and allows them to feel and to think with in an unburdened way, um, and to operate with the freedom from a heavy emotional burden that they tend to carry. Certainly, that was my experience, and it was my experience that I thought that I was an enhanced or super version of myself, that I was able to operate in the world uh, free of what usually felt like uh, a huge emotional burden or load. That I was lightened, that I was enlightened from um, this burden. Maybe you can relate to this, but a lot of my life I was haunted by a sense of shame, of inadequacy, of no matter what I did, never being enough, constantly trying to prove my worth and find my worth and my value by accomplishing things, but never having a deep sense of being valuable. And so there was this hollowness or this void or this emptiness that I think a lot of people carry. And when I used opioids, not only was that all gone, not only did I feel a relief from that emptiness and feel full, but I also felt the absence of all negativity, all anger, all self blame. And I had incredible self blame and negative talk inside my head that would be silenced by the action of the drug. So it was incredibly powerful. At any one point in my history, both before and while using drugs, I can point to events in my life which seemed unbearable. That's why the effect of opioids on my experience, which at least for a time made everything feel quite bearable, at least bearable, if not enjoyable, why that effect was so profound, so irresistible, and once I was addicted, so impossible to give up. It's hard to overstate the power of this feeling. It's almost as if all my life I was abnormal, and then with this drug in my system changing my brain the way it did, that I was finally made normal. So I believed that the drug enabled me to finally think normally and feel normally as a human being on this planet, free of all of the garbage and all of the suffering that I usually encountered. And so the magnetism that drew me towards that, sustaining that type of existence, was incredibly powerful. I like this quote from Gabor Mate, who says about addiction: "It is impossible to understand addiction without asking what relief the addict finds or hopes to find in the drug or the addictive behavior." So for me, opioids, just in the form of a prescription pill given to me for chronic neck pain, changed my reality for a time. Okay, there's a honeymoon period here that I'm talking about. Of course, things do not last, the positive experiences does not last, and the negative comes in and takes over in a profound way. Addiction is not a pretty picture. But I'm one of those people highly sensitive to opioids who was exposed to them at a vulnerable time. So almost immediately, I noticed dramatic changes in my emotional and mental perceptions in my reality, such that I believed I had found a solution to all of my suffering and a secret ingredient to an enhanced, or at least to a normal existence. And this is what I believe happens to people who become hooked on and addicted to medications, to drugs, to opioids in particular, which is my experience. There's a reason why people use and abuse and become addicted to opioids. It's because initially they are perceived as an extremely powerful solution to their life, to the pain and suffering that they're carrying, which we all carry to some degree. Now, of course, like everyone else who becomes addicted, I found that the benefits of using opioids were limited. And as the years passed, I eventually had to behave in ways which violated my own principles and other kinds of boundaries, and ended up doing things I never imagined I could do to support my habit, and all kinds of consequences mounted. And I became very ill with the disease of addiction, and my life became a mess. Everything became singular pursuit of more opioid, and I became a drug addict. I became very ill with the disease of addiction. So the next question, is a corollary to why do people use and abuse drugs is, why do people continue to use drugs when it is obvious that doing so is causing more and more harmful and serious consequences? When the party's over, when it's obvious that whatever solution that initially was never benefit and solution they were initially deriving is being outweighed by consequences. Why does this continue to go on? Why do people continue using and abusing drugs when the consequences are outweighing the benefits? Clearly, in a nutshell, because in addiction, the person has developed a pathological relationship with the drug, in which not only is there physical and psychological dependence, but also a belief has developed in the brain where the drug is thought to be absolutely necessary for survival, and therefore ultimately more important, literally more important than anything else. And on a neurological level, what's going on in the brain, and this is demonstrable by studies including MRI scanning, is that opioids over time alter the brain's pathways involved in behavior reinforcement, reward, and survival. And these nerve circuits are hijacked by the brain, such the addict indeed feels like drug use is essential for survival. That's the neurological experience, are necessary for survival and for existence. And this belief is dramatically reinforced every time he or she goes into withdrawal, which for many drugs, particularly opioids, is a horrible experience. So this helps explain why people need both tremendous courage, but also a highly structured, supportive environment to overcome this, to get clean, and to have the best chance to get clean. They need to have a structured detox environment. So this is a simple video that in a nutshell explains why people start using drugs and then continue to use drugs when they develop the disease of addiction. The drug initially is a solution alleviating some very deep pain, and some people are more susceptible to this than others. um, by both biochemically and biographically. For more information about addiction, please see the whole series of videos which goes into different facets of addiction. And I hope you've enjoyed this. I invite your comments and your feedback and look forward to seeing you again soon. Thank you.